Hello, it's July 28th of 2026, and my name is Malcolm McCallum, and I'm going to be going over some Federal Register announcements on healthcare benefits, immigration, and social policy in the Federal Register. The Federal Register is the official daily publication of the United States federal government. It is where the federal agencies and the President formally publish rules, proposed rules, notices, presidential documents, such as executive orders and proclamations. As I said, I'm Dr. Malcolm McCallum. I hold a PhD in environmental sciences and have over 30 years experience teaching in higher education. As an environmental scientist, my role is to research, educate, and inform about how the world of humans and the world of nature interact. The umbrella of this system in which humans and the natural world interact is called the socio-ecological world, composed of a social world and an ecological world that have a strong network of interactions among them. The overarching purpose of the field of environmental sciences is to protect everyday people from the natural world. To protect everyday people and the natural world from the rich and powerful. So I believe by just explaining what news items appear in the Federal Register, I'll be informing people about the government, what the government is really doing, if they are working for you or someone else. If you want to get more information, if you want to get updated when I post more of these in the future, remember to hit the like button so that other people actually see as you get more likes, YouTube sends these around so people see them. And also, if you subscribe, you'll get notified when I post new ones up. I'm putting them up pretty frequently, so you'll see on just whatever important topics might be posted each week. If you subscribe, you'll always be in the loop and with what they're doing, what they want hidden by distraction campaigns on TV and radio. So, looking at these current things, these current announcements, we have one from DHS immigration fee correction, one from the CMS ACA payment parameters correction, a CMS Medicaid chip T-MSIS and dialysis survey notice, and an ACF Tribal TANF plan guidance renewal. Okay? Each of these has agency contacts whom you are welcome to contact and communicate your feelings or information you might have about these decisions. Some of these decisions are not, well, we'll just move on with that. If we look at the DHS immigration fee correction, we'll just move on. So there's these three documents, and we'll take them one as a group because they're all interrelated. I forgot there were two more. There's one on the HRSA Childhood Vaccine Advisory Commission re-charter, and one on the PBGC Pension Notice Penalty Rule. Okay, and each of these does a different thing. So I'm going to briefly summarize these notices. Taken together, these documents form the July 21st, 2026 snapshot of Federal Social Policy Administration. They are not a single coordinated rulemaking, but they do share a practical theme. Federal agencies are translating larger statutory and political choices into operational systems. The CMS T-MSIS notice turns new Medicaid chip immigration status limits into data elements and disenrollment codes. The DHS correction restores asylum-related employment-authorization processing language in a free related rule. The ACA payment parameters correction tidies the legal text governing 2027 marketplace and basic health program implementation. The ACF notice streamlines Tribal TANF plan guidance. The HRSA notice maintains a vaccine injury advisory structure, and the PBGC proposed rule modernizes enforcement policies for pension plan notice failures. The net effect is therefore administrative but consequential. These notices and rules show how social benefits, legal status, public health compensation, and retirement security are shaped not only by statutes but by the forms, data values, deadlines, penalty schedules, advisory committees, and corrected regulatory text. For citizens, non-citizens, state agencies, tribes, health providers, pension plans, and vulnerable households, those administrative details can decide whether coverage is counted, whether a plan is approved, or whether a fee causes rejection, whether a vaccine injury governance body remains in place, or whether a pension plan is penalized for later notice. The DHS immigration fee correction restores regulatory language unintentionally omitted from the April 29, 2026 interim final rule, preserving the 30-day USCIS processing timeframe for initial employment authorization applications based on pending asylum applications, while DHS continues to consider a separate proposal that could lengthen that timeline. The CMS ACA payment parameters correction corrects typographical errors, technical drafting errors, and omissions in the 2027 ACA Human Health Services Payment Notice and Basic Health Plan Program Rule. Its direct legal effect is technical, but the underlying rule governs marketplace, insured, state, and consumer systems that determine ACA implementation for 2027. The CMS Medicaid CHIP T-MSIS and dialysis survey notice updates the data structure to track immigration status eligibility and disenrollment reasons associated with the new federal funding restrictions, and separately updates the in-center hemodialysis CHAPS survey mode experiment used for dialysis quality reporting. The ACF Tribal TANF plan guidance renewal renews and revises Tribal TANF plan guidance. ACF says the statutory regulations do not change, but the instructions are shortened and reorganized into a clearer checklist format, reducing estimated annual burden from 1,700 hours to 1,170 hours. The HRSA Childhood Vaccine Advisory Commission recharter keeps Advisory Commission on Childhood Vaccines authorized through July 21st of 2028. This is procedurally simple but substantively important because the ACCV advises Human Health Services on the National Vaccine Injury Compensation Program at the politically sensitive time for vaccine governance. The PBGC pension notice penalty rule would codify and modernize PBGC penalty policies for late or missing pension notices and information. It preserves flexible waivers and lowers penalties for small plans, but adds a clear risk-tiered penalty framework for information failures that can threaten plan participants or PBGC insurance funds. The broad policy change is a shift towards compliance infrastructure. These documents are not all big substantive policy reversals. Several are corrections or information collection notices, but each one changes the operational rules by which prior law is carried out. This matters because in health care and benefits policy, implementation rules often determine the practical reach and of the underlying statute. A federal eligibility change may be experienced by states and data reporting change. A congressional fee requirement may be experienced by an asylum applicant as the filing rejection or employment authorization consequence. A pension safety policy may be experienced by plan sponsors as a penalty matrix and by retirees as a stronger notice regime. The CMS Medicaid CHIP notice is the clearest example. Public Law 119-21, the Working Families Tax Cut legislation, amended the Social Security Act sections 1903V and 2107E1 limiting the federal Medicaid and CHIP matching funds to U.S. citizens and nationals, lawful permanent residents, Cuban Haitian entrants, and COFA migrants beginning October 1st, 2026. CMS therefore proposes to update the TMSIS immigration status value set and add eligibility termination reason values related to the immigration status changes or verification. The DHS correction changes the text of 8 CFR 208.7 after the April 29, 2026 interim final rule on immigration fees and related procedures. DHS says the earlier rule unintentionally omitted the sentence requiring USCIS to grant or deny initial employment authorization applications based on pending asylum applications within 30 days. While still preserving the 180-day waiting period before issuance. The July 21st correction restores the language and adds language addressing rejected asylum applications after the new annual asylum fee mechanism. The PBGC proposed rule would move from a 1995 penalty policy statement to codified, more detailed regulations. The PBGC says the 1995 policy does not adequately address many untimely filings, does not cover multi-employer plan lateness under Part 4302, and does not reflect subsequent Title IV changes. The proposed rule supersedes the 1995 policy, but PBGC says it is intended to provide greater detail and certainty rather than change the agency's policy basic compliance posture. The ACF Tribal TANF notice does not change the statutory requirements for Tribal TANF plans. Instead, it changes the guidance format by simplifying language, removing redundancy, shortening and organizing instructions, and aligning the submission format more clearly with federal review. ACF estimates a reduction in average response time from 68 hours to 45.6 hours and a drop in annual burden from 1,700 to 1,170 hours. The HRSA ACCV notice changes policy only in the narrow administrative sense that it reauthorizes the Advisory Commission on Childhood Vaccines through July 21st of 2028, but the policy's significance is larger because vaccine injury compensation is an important accountability mechanism in the immunization system. Rechartering preserves an advisory forum for recommendations to Health and Human Services on the National Vaccine Injury Compensation Program. The ACA, the payment parameters correction, is formally technical. It corrects typographical errors, technical drafting errors, and omissions in the May 20th, 2026 final rule governing 2027 ACA payment parameters and the Basic Health Program. The practical significance is that Marketplace and Basic Health Program operations depend on exact regulatory text even when the change is labeled at a correction. The shared rationale across the set of administrative capacity. Agencies are making complex social programs enforceable, auditable, and less ambiguous. The CMS emphasizes oversight, actuarial forecasting, federal matching fund compliance, and data utility. DHS emphasizes correction of inadvertent omission and continuity of current regulatory text. PBGC emphasizes predictability, voluntary self-reporting, self-correction, and risk-based penalties. ACF emphasizes clarity and reduces burden to tribal governments. HRSA emphasizes continuity of the FACA Advisory Committee, and CMS Health and Human Services emphasizes current wording in the ACA rule. The rationale has a second layer. These actions reveal the tension between program integrity and access. Stronger data systems can reduce improper federal payments and improve oversight, but they can also create new administrative barriers for people whose eligibility or legal status is difficult to document. Immigration fee and employment authorization rules can be defended as statutory implementation, but they also impose high-stakes consequences on the asylum applicants. Pension penalties can protect participants and insurance funds, but excessive penalties can burden small plans and employers. Vaccine advisory bodies can improve trust if they are independent and credible, but can also become arenas of conflict when vaccine policy is politicized. The Department of Homeland Security immigration fee correction frames the correction as a non-substantive repair. It restores regulatory language that was unintentionally removed and maintains the existing 30-day adjudication text, which, while a separate pending rulemaking, considers longer-term changes to asylum-based EAD processing. CMS ACA. The CMS Health and Human Services frame is a technical correction of the 2027 payment notice and the Basic Health Program regulation. The rationale is legal currency and operational clarity rather than new substantive policy choice. The Medicaid CHIP dialysis survey notice frames the data changes as necessary to implement Public Law 119-21, support proper federal financial participation, claiming monitored disenrollment related to immigration status changes, and the improved oversight of home health payment reporting and dialysis quality measurement. The ACF frames the Tribal TANF change as a burden reduction and usability improvement. The agency keeps statutory requirements intact, but rewrites and reorganizes the guidance to reduce reading time and make approval requirements clearer. HRSA frames the ACCV action, the Childhood Vaccine Action, as routine. The FACA continuity. The rationale is to preserve an advisory body that can provide recommendations on vaccine injury, compensation, and related issues. PBGC frames the proposed rule as a modernization and codification of penalty policy. It aims to encourage voluntary self-reporting and self-correction while using higher penalties and time-sensitive information failures that pose greater risk to participants or PBGC insurance programs. These 6 documents have different levels of political visibility. The immigration, Medicaid, CHIP, and ACA-related items fit directly into the partisan fight over H.R. 1 /Working Families Tax Cut implementation, Medicaid financing, immigration restrictions, and ACA marketplace policy. The Vaccine Commission notice sits in a politicized vaccine governance context, although the recharter itself is procedural. The PBGC and Tribal TANF items are less overtly partisan and are more likely to draw technocratic stakeholder comments than speeches from elected officials. Republican viewpoints generally emphasize the program integrity, federal fiscal control, fraud and abuse prevention, immigration law enforcement, work community engagement links, and the idea that benefits should be reserved for eligible citizens and narrow categories of qualified non-citizens. The CMS implementation materials describe Public Law 119-21 as containing significant Medicaid CHIP eligibility and financing reforms and focusing on the connection of health to work through community engagement. Republican arguments around the broader law tend to defend such measures as necessary to curb waste control spending and target benefits. The Democratic viewpoints generally emphasize coverage loss, administrative barriers, fear and chilling effects among immigrant families, reduced access to health care, higher marketplace costs, and the risk that technical implementation mechanisms can mask substantive benefit reductions. AP reporting on the Republican Medicaid package noted that Democrats warned of people losing coverage and presented the package as a covert rollback of ACA Medicaid protections, while Republicans defended the changes as anti-fraud and budget control measures. For vaccine governance, partisan lines are less clear on the Medicaid and immigration. Some Republican and Democratic officials have supported vaccine safety oversight and injury compensation mechanisms, but contemporary vaccine advisory committees are embedded in broader debates over public trust, scientific independence, vaccine hesitancy, and the role of the Health and Human Services leadership. The ACCV, rechartered itself, does not announce a substantive vaccine policy, but the advisory structure remains important because compensation and transparency can either strengthen or weaken trust in vaccination programs. For PBGC, the political framework is less partisan and more institutional. Workers and retirees benefit from timely notices and stronger pension insurance oversight. Employers and plan sponsors benefit from predictable, proportionate penalties and waiver rules. The proposed rule explicitly tries to occupy the middle ground by using low daily penalties for many filings, risk-tiered penalties for high harm failures, and proportional reductions for small plans and waiver discretion. The health policy literature consistently shows that coverage rules, administrative burden, eligibility verification systems can be as important as statutory eligibility itself. Eligibility restrictions eligibility restrictions can reduce public spending and improper claiming, but they can also reduce participation among eligible people when documentation, fear, stigma, or complexity increase. This matters most for Medicaid, CHIP, asylum applicants, and immigrant households, because the people affected often face language, legal, health, transportation, and economic barriers simultaneously. The Medicaid CHIP notice is a data governance action, but data governance is not neutral. Good data allow oversight, actuarial forecasting, policy evaluation, and detection of improper claims. At the same time, adding immigration status and disenrollment reason coding can turn health program administration into immigration status surveillance if not carefully governed by privacy, due process, and civil rights protections. The strongest argument for the notice is the program integrity. The strongest argument against it is the eligibility tracking may accelerate coverage loss and chilling effects for lawfully present immigrants and mixed status families. The Tribal TANF notice reflects another administrative burden issue. Simplifying plan guidance is potentially beneficial because tribal governments operate TANF programs under federal rules but with distinctive sovereignty, community, and capacity context. Reducing estimated burden by roughly 1/3 is valuable if the simplified form preserves tribal flexibility and does not omit information needed for accountability. The PBGC proposed rule is supported by institutional design logic. Penalty schedules should be predictable enough to guide behavior, flexible enough to avoid disproportionate punishment, and strong enough to deter information failures that harm participants or insurance funds. PBGC explicitly builds these considerations into its proposal by distinguishing lower risk late filings from time-sensitive reports and by protecting small plans from excessive penalties. For vaccine governance, advisory bodies matter because the public health agency depends on transparency, expertise, conflict of interest controls, and perceived independence. The ACCV is not the same body as the ACIP, but both operate in a public environment where vaccine confidence can be affected by committee composition, advisory procedures, and quality of federal communication. Rechartering ACCV preserves a formal forum of a formal forum for vaccine injury compensation advice, which can support trust in the body if the body is credible and transparent. The most affected populations are those whose access to health coverage, legal work authorization, tribal assistance funding, pension protections, and vaccine injury compensation depends on administrative systems rather than only the broad statutory language. Administrative rules are not abstract here. A corrected sentence can affect an asylum applicant's ability to work. A data code can affect Medicaid CHIP oversight and disenrollment. A plan guidance rewrite can affect tribal capacity. A penalty matrix can affect pension plan compliance, and an advisory commission charter can affect vaccine injury governance. The most affected individuals are the lawfully present immigrants and mixed status families affected by Medicaid CHIP federal matching restrictions, asylum applicants waiting for employment authorization, state Medicaid and CHIP agencies, dialysis patients, and facilities participating in the ICHCA HPS, tribal governments administrating TANF, and participants in private defined benefit pension plans, and people pursuing or following vaccine injury compensation policy. The least directly affected by these changes are the individuals whose health coverage is not tied to Medicaid or CHIP eligibility, immigration status categories, ACA marketplace rule text, or basic health program administration, pension arrangements outside of PBGC covered defined benefit plans, and vaccine policy issues unrelated to injury compensation or ACCV recommendations. Unlike the Endangered Species Act and public lands reviews, which I've discussed earlier, these actions are not primarily about ecosystems, obviously. Their socio-ecological relevance lies in the human social system: health, labor, immigration, family assistance, pensions, trust, governance, and institutional capacity. Public health and social policy are components of the broader socio-ecological system because they influence population vulnerability, household resilience, local economies. Just a second. Battery's going out there. Plug it in. Okay. Local economies, community stability, and the capacity of people to adapt to environmental, economic, and political stressors. The Medicaid CHIP and ACA items directly shape health system access. Loss of coverage or confusion over eligibility can produce delayed care, increased uncompensated care, stress for safety net providers, and poor household resilience. The DHS correction, Department of Homeland Security correction, affects labor market participation and household stability for asylum applicants. The tribal guidance affects the ability of tribal governments to administer family assistance in culturally and locally appropriate ways. The PBGC penalties affect retirement security and confidence in employer-sponsored pensions. And the vaccine injury advisory governance affects public trust in the immunization systems. The main systems level concern is cumulative administrative burden. There have been massive layoffs in the federal government, so you don't have as many people doing the work that they once did. And I'm not talking about the recent layoffs by the current administration. I'm talking about over the last 30 to 40 years. It has been continually the labor force has been reduced, but the expectations for workload have been increased and paperwork and everything else. So each action may be justifiable in isolation, but the combined environment may become more difficult for vulnerable households and small governmental or private actors to navigate. Conversely, well-designed administrative systems can improve transparency, compliance, and program performance. The policy question is whether these notices improve governance without creating barriers that disproportionately fall on people with the least capacity to navigate complex systems. Health coverage and access are likely affected by this in a mixed to negative manner. Because affected immigrant categories, if implementation leads to disenrollment or chilling effects, then they would have mixed to negative impacts. There could be positive impacts for federal fiscal oversight, though. Some specific examples include the CMS Immigration Status and Termination Code updates and the ACA payment parameters correction. When we talk about immigration and work authorization, there's narrowly positive. The likely effect is narrowly positive because it restores the 30-day processing language. Broader fee regime remains restrictive. DHS specific examples are the DHS correction to the 8 CFR 208.7 for initial asylum-based EAD adjudication. The tribal governance issue component is likely a positive impact if simplified guidance reduces burden without narrowing the program substance. Specific examples here are the ACF Tribal TANF plan guidance burden reduction from 68 to 45.6 hours per response. The pension benefit security is likely is positive for transparency and participant protection, and then it has moderate impacts for compliance burden for plan sponsors. The PBGC specific example of that is the PBGC risk tiered penalty framework and the waiver self-correction provisions. From the perspective of the public health trust, the likely effect is potentially positive if advisory recharter supports transparency if it's potentially positive if advisory recharter supports transparency. It's vulnerable if it's vulnerable to politicization if advisory independence is questioned. And an example of this is the HRSA recharter of the ACCV through July 21st of 2028. The administrative burden will probably have mixed likely effects. Some notices reduce burden, but others increase compliance complexity. And here the ACF reduces tribal guidance burden, but the CMS adds more granular data reporting, and PBGC adds more detailed penalty rules. So you've got fewer people doing more work. Equity and vulnerability impacts. This is the key risk is disproportionate effect on immigrants, low-income households, tribes, dialysis patients, retirees, and people with limited legal or administrative capacity. Some examples of this are the Medicaid CHIP eligibility coding, asylum EAD consequences, and the Tribal TANF plan approval and the pension notices. The overall assessment of these policy changes, the strongest interpretation is that these notices are about the machinery of governance. They do not all announce major new substantive programs, but they translate major policy choices into forms, data systems, deadlines, corrections, committees, and penalties that actually control program access and institutional behavior. The highest stakes item is the CMS Medicaid CHIP notice because it operationalizes immigration status based on federal funding limits in the national Medicaid data system. The most directly applicant-facing item is the DHS correction, Department of Homeland Security, because it preserves a processing time guarantee for asylum-related employment authorization. The most pro-governance burden reduction item is the ACF Tribal TANF guidance revision. The most public health trust item is the HRSA ACZV recharter, and the most retirement security item is the PBGC proposed penalty rule. The ACA correction is the least visible, but still important because the exact rule text governs marketplace implementation. For the video, okay. And that's all I'm going to tell you about that. If you go back to these respective changes, you can read them in the Federal Register. Just look up their titles, and they should come up pretty well on in the July 21st issue. The next issue I put up will be for this week. Will be new stuff that's come up since as of Monday, and we'll see what happens, what new stuff is cooking in the executive branch. Have a nice day.